So good day everyone, I'm Maria Hollis and now I'll be demonstrating a return demonstration which is the bed making unoccupied. So first I already gathered materials so I'll be ready so I can save time. So next is I'll be sanitizing my hands using alcohol and I'll put gloves as needed and to protect myself from microorganisms and bacteria. So next is, if you are in clinical bedside, you need to adjust the side rail so that you will feel comfortable during the demonstration and to prevent muscle pain or back pain. So next is, I already put a hand gloves and next, so next is you are needing to disconnect all the, for example, linings or IV tubings or gloves that you see in the bedside and in this scenario, I don't see anything in the bed. So next is you are needing to disconnect all the, for example, linings or IV tubings or gloves that you see in the bedside. And in this scenario, I don't see anything in the bed. So next. So next is I'll be losing all the linens, including the pillowcase, and I'll be putting it on center. So after I lose all the linen, so I'll be putting this soiled linen at the hamper. So do not put the soiled linen on the floor so that we can prevent microorganisms or any bacteria in our body. So I'll put this on a hamper. Okay. Next is I'll be removing my hand gloves so that it will prevent microorganisms or bacteria. So I already removed my gloves and I already removed the pillow. So next is I'll be putting this clean lower or top linen. Okay. So next is I'll be putting a draw sheet on the center of this lower linen. I'll be putting a new and clean pillowcase on the pillow as well. Next is I'll be putting a clean top linen on the bed. hamper or basket, depending on agency policy. So next is I'll be sanitizing my hands using an alcohol again so that I can prevent microorganisms and bacteria. So that's all the procedures of bed making unoccupied. I am Mariel Giacolis, a student nurse from Our Lady of Fatima University, and now I'll be demonstrating a return demonstration, which is the bed making in unoccupied. So first, I'll be checking the chart for limitation of patient for physical activity. Then next is I'll be gathering the equipment that I'll be needing on this demonstration. Then next is I'll be performing a hand hygiene. And I'll be putting a gloves as well. So since I don't have a clean gloves, I'll be using a sterile gloves. So but it doesn't necessarily to use a sterile gloves. Clean gloves can do. Next is I'll be identifying the patient and to make sure that I'll be giving the right intervention on the right patient. So good morning, ma'am. I am Mariel Giacolis, and I'll be your nurse from 6 a.m. to 6 p.m. Can you state your name as well as your birthday?
My name is Dinner Palma. My birthday is December 27,000.
Okay, thank you. So for next is I'll be identifying her ID band for verification purposes, ma'am. So ma'am, can I check your ID band? Okay, thank you. So next is I'll be closing the door as well as the window for our privacy. Okay. So next, of course, if you are in clinical side, you need to lower the side rail of the bed. So that we make sure that the patient is in right posture, and it will not cause injury or falling off patient. So next is I already put gloves, and I'll be checking if are there any objects in the side bed. Okay, so assuming that I already checked the side bed. So next is I'll be placing a bed bag on top of the chest of the patient. So para maalis ko po yung soiled linen, and babalitan ko siya ng bed bag. So babalitan po natin yung soiled linen. Pakihawak po yung ating bed bath linen. Okay. Patanggalin ko na po yung kanilang So after I replace the solid linen with the bed bath linen, I'll be needing to drop this on the hamper and just like this. So next is I'll be assisting the patient on the opposite side, and ilalagay ko po yung unan sa baba ng head niya. So ma'am, kindly I'll be assisting you on opposite side po. Okay. So next, after I assist the patient to the opposite side, then I'll be loosening all the bottom linens and the side to the top, bottom, and to the both side of the rails. So okay, so next is on the side, on the opposite side. Ma'am, I'll be assisting you on opposite side again so that I can remove this bottom linen. Okay, so. Okay, ma'am, thank you. So next is I'll be putting this linen on the side of the patient. Ma'am, I'll be assisting you on opposite side again so that I can put the clean top linen. Okay. Okay, ma'am. Next, after I lose all the soiled linen, I'll be remove the pillow and change the pillowcase. So next, so ma'am, I'll be assisting you. And of course, I'll be putting this on a hamper as well as. So next is I'll be putting it back to the head of the patient. So ma'am. So next is I'll be applying top linen sheet and blanket, and if desired, so that it is centered on the patient, and I'll be removing the bed bath linen and put this clean top linen. Okay. Okay, ma'am. So tatanggalin ko na po yung isang bed bath na nilagay natin a while ago. Paki-hold po. Next is I'll be returning the patient into position, into comfortably position or comfortable position. So ma'am, okay lang po ba kayo? Okay po. Okay. So next is, if you are in clinical side, of course you need to raise the both of side rail so that the patient is comfortable, and we can prevent like an accident or falling of patient. So next is I'll be removing my PPE, and I'll be sanitizing my hands using alcohol aspect. Okay. Of course, after I've done with removing my PPE and sanitize my hands using an alcohol, of course I'll be dispose of soiled linens according to the agency policy. So that's all the process of bed making in an occupied bed. Okay.